After 60. Authority. Life goes on after 60.
If you are over 60 and getting breathless walking to the mailbox, coughing up phlegm every morning, or feeling your chest tightened in cold air, you might think it's just out of shape or normal aging. But lung specialists warn that these are the earliest signs of COPD and lung disease affecting 2.4 million Australians. And by the time you're gasping for air, permanent lung damage is done. Today, you'll discover the 7 silent lung warning signs most seniors ignore, why women are diagnosed later with worse outcomes, and the proven steps to save your lungs before they fail.
Australia faces an often overlooked crisis in lung health, with 2.4 million adults, or 1 in 8 Australians, living with chronic lung disease, predominantly COPD, chronic obstructive pulmonary disease. Tragically, up to 70% of COPD cases in seniors over 60 could have been prevented through smoking cessation and timely intervention. Each year, lung diseases claim more lives in Australia than breast or prostate cancer combined. COPD alone is responsible for 9,000 deaths annually and results in a staggering $10 billion expense for the healthcare system, encompassing hospital admissions, oxygen therapy, and emergency care. The most concerning aspect is the subtlety of early symptoms. 80% of individuals fail to recognize the warning signs for up to 5 to 10 years before receiving a diagnosis. By then, they have already lost approximately half of their lung function irreversibly. For Australians over 60, here are vital statistics about chronic lung disease. 2.4 million Australians suffer from conditions like COPD, asthma, bronchiectasis, and interstitial lung disease. 1 in 4 current or former smokers over 60 experiences undiagnosed COPD. Smoking directly contributes to 70% of all COPD cases. Women are diagnosed 2 years later than men, often with more severe symptoms. Each cigarette reduces lung function by 1 to 2%. By age 70, smokers have lost half their lung capacity compared to non-smokers. COPD ranks as the 3rd leading cause of death in Australia after heart disease and cancer. The impact of lung disease after the age of 60 is devastating because lungs cannot regenerate. Any damage is permanent. This leads to distressing consequences such as increased breathlessness causing social isolation and reduced physical activity, repeated chest infections requiring hospitalization, right heart failure due to chronic lung strain, oxygen dependency, and a significantly reduced life expectancy. Severe COPD alone can shorten lives by 8 to 10 years. However, the positive news lies in the fact that quitting smoking at any age drastically slows the progression of the disease, even for those who have smoked for 4 decades or more. Pulmonary rehabilitation can improve both lung function and quality of life by up to 50%, while early diagnosis via spirometry can identify COPD before symptoms become debilitating. Education is vital. Many seniors dismiss key warning signs as an inevitable part of aging. Learning about lung health can highlight what accelerates damage and provide actionable solutions to preserve breathing capacity and maintain independence. Understanding COPD, the silent thief of breath, is crucial. It's a progressive condition marked by inflamed, narrowed airways filled with mucus that gradually make breathing more difficult. Conditions like emphysema, damage to air sacs, and chronic bronchitis, inflamed airways, fall under this umbrella term. COPD develops primarily from exposure to irritants, 90% through smoking. The rest arises from inhaling air pollution and occupational dust or chemicals. Over time, inflammation permanently alters airways and destroys oxygen exchange surfaces in the lungs, leading to persistent breathlessness. COPD progresses through 4 stages. Mild, Stage 1 symptoms like coughing and phlegm are easily dismissed. Moderate, Stage 2 shortness of breath during simple activities like walking on flat terrain becomes noticeable. Severe, Stage 3 breathlessness occurs even at rest, and oxygen may be required. Very severe, Stage 4 life-threatening complications that demand repeated hospitalizations. Those at greatest risk include current or former smokers who have smoked heavily, 20-plus pack years, adults over 60 whose lung function naturally decreases with age, individuals with frequent respiratory infections across their lifetime, those exposed to occupational dust or fumes, people with asthma, especially if poorly managed, individuals with genetic conditions like alpha-1 antitrypsin deficiency, and both underweight and obese individuals. Women also face increased risk due to smaller airways that are more vulnerable to smoke damage. One of the earliest indicators of potential chronic lung issues is a morning cough producing phlegm, a symptom commonly referred to as smoker's cough. This persistent cough occurs daily and lasts for extended periods, 3+ months annually over 2 or more consecutive years. Many misunderstand this symptom as normal due to smoking, seasonal changes, allergies, or minor illnesses. What's truly happening is inflammation exacerbating mucus production in the airways, causing damage that narrows those pathways permanently. Ignoring this symptom leads to progression. A morning cough in year 1 evolves into breathlessness after 5 years and dependence on oxygen by 10 years. Chronic inflammation triggers excessive mucus production while irritating airways, a chain of reactions with long-term impacts on respiratory health. To act upon early symptoms: 1. Consult a GP to undergo spirometry, a Medicare-rebated diagnostic test measuring vital lung function markers. 2. Quit smoking immediately. Benefits begin within just 2 weeks while stabilizing lung function within 1 year. Quitting greatly reduces the risk of disease progression. Addressing these: Step 3. Use of inhalers upon diagnosis: long-acting bronchodilators, LABA, inhaled corticosteroids, ICS, if necessary. Step 4. Techniques for clearing mucus: active cycle breathing, postural drainage, staying hydrated. Sign number 2. Worsening breathlessness. Dyspnea during activity. How it presents. You experience increasing breathlessness during activities such as walking on flat ground, which wasn't an issue 2 years ago, climbing less than a single flight of stairs, carrying shopping bags for less than 50 meters, bending to dress, like putting on socks or shoes, after taking a shower. Why it's significant. Progressive breathlessness indicates ongoing lung damage, which hampers the lung's ability to provide adequate oxygen to the body. Understanding the MRC breathlessness scale: Grade 1, breathless only with intense physical exertion. Grade 2, breathless when hurrying or going slightly uphill. Grade 3, walk slower than peers on flat ground due to breathlessness. Grade 4, stops after walking about 100 meters on flat ground. Grade 5, too breathless to leave the house at all. Urgency triggers: if you've reached Grade 3 or higher, an urgent lung function assessment is necessary. What this means: a combination of airflow limitations due to narrowed airways and irreversible damage to air sacs, emphysema, has led to reduced oxygen delivery. Recommended actions: Step 1. Seek urgent spirometry testing. Step 2. Request a referral to pulmonary rehabilitation. Step 3. Take a 6-minute walking test to assess your functional capacity. Step 4. Undergo an oxygen level assessment for severe breathlessness. Step 5. Stop smoking immediately. This is the most critical step you can take for your lung health. Sign number 3. Wheezing or chest tightness, particularly at night or in cold air. How it presents. You may feel a tight sensation across your chest, like a band constricting it. You might also notice audible wheezing, a high-pitched musical sound when breathing. Symptoms often worsen at night, in cold air, after exercise, or when exposed to smoke. Sitting forward might bring relief. Why it's significant. Bronchospasm and airway inflammation signal that your airways are constricting and swelling, reducing airflow. While this is characteristic of early-stage COPD and may still be reversible, unchecked symptoms can lead to irreversible damage over time. Nighttime symptoms suggest significant airway inflammation that requires urgent attention. Understanding the mechanism. Increased bronchial responsiveness combined with inflammation leads to bronchoconstriction, which causes wheezing and chest tightness. Recommended actions. Step 1. Monitor peak flow to track lung function at home. Step 2. Test the effectiveness of a reliever inhaler like Ventolin or salbutamol. Step 3. Conduct spirometry and a bronchodilator response test for further evaluation. Step 4. Consider prescribing a long-acting bronchodilator if the response to initial treatment is positive. Sign number 4, frequent chest infections, recurrent bronchitis, characteristics, experiencing 2 or more chest infections annually that require antibiotics. Symptoms include a worsening cough, increased production of green or yellow phlegm, fever, and feeling unwell for 7 to 14 days. The infection may not completely clear between episodes. Significance: damaged lungs struggle to fight infections, leading to inflamed airways that trap bacteria. This can cause recurrent infections and further lung damage, creating a harmful cycle. Exacerbations can significantly accelerate the decline in lung function, with each incident potentially reducing FEV1 by 50 to 100 milliliters. Underlying cause: failure of mucociliary clearance combined with bacterial colonization drives recurrent infections. Recommended actions. Step 1. Conduct a sputum culture to identify the specific bacteria. Step 2. Stay up to date with influenza and pneumococcal vaccines. Step 3. Enroll in pulmonary rehabilitation to enhance mucus clearance. Step 4. Consider long-term antibiotics for frequent exacerbations. Step 5. Practice chest physiotherapy regularly. Sign number 5. Unexplained weight loss and muscle wasting characteristics. Unexpected weight loss despite maintaining a normal appetite. Clothes may fit loosely around the waist or chest, accompanied by noticeable muscle reduction and weakness. Individuals may feel as though they are melting away. Significance: COPD-related cachexia occurs as the lungs work excessively to facilitate breathing, forcing the body to break down muscle and fat to supply energy. This condition is associated with worse health outcomes and higher mortality rates. A BMI under 21 signals poor prognosis. Underlying cause: systemic inflammation coupled with increased energy demands for breathing leads to muscle and fat breakdown. Recommended actions. Step 1. Perform a BMI and nutritional assessment. Step 2. Adopt a high-calorie, high-protein diet. Step 3. Engage in resistance exercises, possibly as part of pulmonary rehabilitation. Step 4. In severe cases, short-term use of anabolic steroids like prednisolone may be necessary. Sign number 6. Swollen legs, ankles, and blue lips are fingers characteristics. Swelling occurs in the legs and ankles, worsening toward the evening, along with blue or purple coloration of lips and fingertips, cyanosis. Additional symptoms could include a swollen abdomen and needing multiple pillows to sleep comfortably. Significance: these signs may point toward cor pulmonale, right-sided heart failure caused by lung disease. This is a critical end-stage indicator that requires urgent medical attention as heart and systemic function can rapidly deteriorate. Underlying cause: chronic oxygen deprivation, hypoxia, leads to pulmonary hypertension, causing the right side of the heart to fail, which results in peripheral swelling. Recommended actions. Step 1. Seek immediate hospital assessment for emergency intervention. Step 2. Use oxygen therapy as needed. Step 3. Administer diuretics like furosemide to manage fluid retention. Step 4. Undergo an echocardiogram to evaluate heart function. Sign number 7. Extensive smoking history without lung function testing characteristics. Smoking 1 or more packs per day for at least 20 years, or 2 packs daily for 10 years, without undergoing spirometry to assess lung function. Significance: approximately 90% of COPD cases arise from smoking, often with damage occurring even in asymptomatic individuals. Spirometry screening is essential for smokers aged 40+, ex-smokers within the past 15 years, or those exposed to occupational dust chemicals. Recommended actions. Step 1. Request spirometry from your GP, Medicare rebate available. Step 2. Quit smoking right away, regardless of current lung function results. Step 3. Repeat spirometry annually if abnormalities are detected. The Lung Rescue Plan. 7 essential steps. Step 1. Get a spirometry test. Schedule it immediately via GP referral. May be covered by Medicare. Step 2. Quit smoking. Contact Quitline at 13-7848 for free counseling and assistance with cessation methods such as nicotine replacement therapy or prescribed medications like Champix or varenicline. Alternative approaches like hypnotherapy or acupuncture may also help. Step 3. Engage in pulmonary rehabilitation with an 8-12-week program combining exercise and education for symptom improvement of up to 50%. Step 4. Follow a tiered medication plan based on severity. Short-acting bronchodilators for mild symptoms, long-acting bronchodilators for moderate issues, and triple therapy, LABA, LAMA, ICS, for severe cases. Step 5. Stay updated with annual vaccinations, including influenza, pneumococcal, COVID, RSV, if recommended.